Hi, this is Kristen Digwood from Elite Pelvic Rehab in Wilkes-Barre, Pennsylvania, and I'm going to talk a little bit about what we do in physical therapy for pudendal neuralgia. Pudendal neuralgia tends to be something that makes the pelvic floor overreact. So in physical therapy, we'll do things to downtrain or relax the pelvic floor off the nerve. This could be biofeedback, electrical stimulation, ultrasound, stretches. One of the big things we do is we try to access the root of the nerve in its path to get some of the pressure off of it. So we know that the pudendal nerve comes down and it exits the spine, and it'll come through and it'll be in and around the area of one of the muscles called the piriformis. So as you lie there, we'll press in that area, and often patients who have that problem will say that's exactly the symptom I've been having. So if it's pain right in your sits area, when we press on that, patients will say, oh gosh, yeah, that's exactly it. From there, we'll look around the area of the ligaments around the sacrum. The nerve tends to pass through that area, and it could be one of the areas of irritation. Then it'll come down around the pubic rami, and when we get in there and we hook around it, we'll also see that patients have tenderness there, or they have a replication of symptoms. The more difficult spot to get to is an internal area called Alcott's Canal. The nerve will run through that area, and often when we do our internal exam, if we hit that area, a patient will immediately feel that that's the area that's replicating their symptoms. Our goal in physical therapy then is to get the tissue to back off the nerve. So what we do, myofascial release, we do soft tissue mobilization, we'll do some stretching of the tissue so that over a period of time it stops pressing on the nerve and stops sending those signals. And patients will start to say, I'm able to sit for longer, I'm able to have a pelvic exam without the kind of pain I was having. Some of their urinary or their fecal problems will start to subside, and we'll know that we're on the right track to getting the pressure off the nerve. We always then teach the patient how to manage their own symptoms so that they're able to do so at home, and if they ever have a problem creep up again in that area, they're enabled to stop it in its tracks. So over time, people will be able to get back to their normal routine and their normal life and not have these problems impact them.